Now that we know the major anatomical structures that make up the hip joint, we will dive a bit deeper to know a little more. Possible movements. The hip joint is a multi-axial joint, which means it rotates on more than one axis, allowing for a wide range of movements. The hip joint allows for flexion, extension, abduction, adduction, and internal and external rotation. Articulating surfaces. The hip joint is made by the articulation between the acetabulum and the head of the femur. The joint is, therefore, also known as the acetabulofemoral joint. The following structures will be discussed in the rest of the video: acetabular labrum, lunate surface, fovea, ligamentum teres, acetabular fossa, acetabular notch. The anatomy and the structures within the acetabulum and on the head of the femur are best understood when viewed from the side. This is a lateral sketch of the hip bone. The femur has been removed to explain the small structures. The rim of the acetabulum is lined with fibrocartilage, which is known as the acetabular labrum. Part of the labrum joins the acetabular notch as the transverse acetabular ligament. Thus, the acetabular labrum can be defined as a ring around the acetabulum, composed of fibrocartilage and dense connective tissue. It covers the femoral head and increases the surface area of the acetabulum, thereby stabilizing the joint. Friction between the head of the femur and the acetabulum is prevented by the presence of articular cartilage, which is a thin layer of hyaline cartilage that covers the articulating surfaces of both the head of the femur and the acetabulum. The head of the femur is mostly covered with articulating cartilage, with the exception of a small area in the middle, known as the fovea. The fovea is frequently visible as a small depression on the AP hip or pelvis X-rays, and is almost always visible on CT images. The fovea is a small depression. It is the site of attachment for the ligamentum teres, also known as the ligament of the head of the femur. Ligament of the head of the femur runs from the acetabular fossa to the fovea of the femur. The articulating surface of the acetabulum is a horseshoe-shaped structure and is known as the lunate surface. The lunate surface is actually the structure that is in contact with the head of the femur. The deeper part in the middle of the acetabulum is the non-articular area, known as the acetabular fossa, which is filled with fat. The acetabular notch is a deep notch in the acetabulum. The acetabular notch is continuous with the acetabular fossa at the bottom of the cavity. This depression is perforated and has a mass of fat. The notch is converted into a foramen by the transverse acetabular ligament. Vessels and nerves enter the joint through the foramen.